Hello, and welcome to another episode of The Everyday Leader. I am your host, Dr. Ananya. I am here today with my good friend, Dr. Abdirashid. He is an orthopedic surgeon, fellow trained in joint replacement and sports. He is also the CEO of Dr. Ismael Specialty Hospital, one of the biggest private hospitals in orthopedic surgery in Hargeissa, Somaliland. He is young and driven with an impressive track record both in public and private sector of orthopedic practice. I'm so excited to have my friend here. Dr. Abdirashid, welcome to the Everyday Leader.
Thank you very much, Ananya, for inviting me to the Everyday Leader podcast.
Oh, that's great. So we're gonna start as we usually do. What does the phrase everyday leader mean to you personally? And were there any moments that in your life and in your journey that you finally felt like I'm a leader, I'm now leading and realize that you're a leader?
Thank you, Ananya. For me, a leader is someone who doesn't wait a title or a position. It's the nurse who is awake at night to take care of a patient, the doctor who prepares our patients so that we can have a better surgery tomorrow. It's not the title or the position. It's someone who is doing service. And yeah, personally, I had a leadership. I felt that I was a leader when I graduated from orthopedics in Ethiopia. I came back here. Um, it was a pivotal moment. So I was about to launch a hospital, and you feel it. That's when I felt my leadership.
I love that. I think everybody here who's been my guest has shared your thought on that. Leadership is something you do every day. It depends on the level of, the team you lead, the size of the team you lead, or the resources that you are assigned. But everybody does some sort of leadership every single day at their own level. And you have the privilege of having your own hospital, which is very rare, right? Because a lot of us start leading from maybe in a public hospital or in a government setup, and then go to private sector. But for you, it was there and it was ready. So I want to come back to that. So take me through your journey from childhood through medical training to where you are today. What shaped your path, and what experiences in that time defined who you are today?
Uh, Actually, I was surrounded by a medical family. My father was an orthopedic surgeon. He graduated from Germany in 1984 with orthopedics. And in 1979, he was the director of Hargeissa Group Hospital at that time. And my mother was also a nurse. So there were a lot of civil wars, and I met one. And at that time, I saw my father doing helping patients, taking care of them in a difficult situation. So even though I was young, I used to assist him, like taking care of his, sometimes repairing the lights, torches that he was using to take care of patients. And when my mother gets sick, I was the one she trained to, uh, uh, the one she trained to do IV cannula injections and all that. So I was, yeah, because it was civil war, we were refugees, and it was in a very difficult situation. So I think that's the thing that shaped my path.
That is extremely impressive. So how old were you when this was happening?
Can I say like 30? Yeah,
13? 1
yeah,
3? Oh
Yeah,
my gosh. Oh my gosh. This is, you know what? I've always known your story is amazing just because we know each other. But I never thought that it was even, I am surprised right now.
yeah.
Wow. Okay, so were you in a camp, in a refugee camp, you said? Which war was this?
Uh, Actually, this when the refugee come, it was in Ethiopia, I can say, because that's when civil wars happened here. We used to go there, just the border, and it was just in a. We had the school. It was just a normal life. I can't say we were refugees, but just maybe the name. Yeah,
Yeah, you're just not at your country. That's just it.
yeah, yeah,
Um,
yeah.
it's so interesting. And I love that. Um, there's so much to talk about just that term refugee, but you're not really a refugee. I mean, it's going to be out of the scope of this interview, but
Definitely.
yeah. So, like you said, your father was already an orthopedic surgeon, your mom a nurse, which means expectations on you were so high. And having seen your parents perform, uh, medical work in such a resource constrained, high pressure, high stake environment, how was that expectation? Was it overwhelming? Did you ever felt like it's so overwhelming, or how did you handle it? I wonder.
I don't know if I'm different, but I just never felt overwhelmed. I was, I feel like I don't know if I was enjoying it. We had so many challenges and we just went through it. Yeah,
That's amazing. I love that. There's so much to learn just from that. Um, yeah, because I wonder if the current generation feels that way, um because we are now globally, I don't know, for whatever reason, it in a way it's good, but it also has its drawbacks. We're very sensitive to small things, and our pain tolerance has gone down. um so anything that's adverse tends to break people nowadays instead of
yeah.
making them strong. So it's very interesting to see somebody as young as you, we're not that old, as young as you, to see that, to grow up in that environment and just say, it wasn't really a pressure. So
Yeah,
um,
most of the time, like my father was taking care of patients, and I mean, like people who were. So most of the time, it was me, my older brother or sister, with mom. So she was taking care of us. She was always around, while my father was a hero on the other side. So most of the time, he was not with us. Yeah.
that's amazing. That's a huge sacrifice. So can you tell us what orthopedic looked like? You kind of touched on it, but after you went back home, the civil war breaks, and then a relative peace comes back, and then back and forth for quite a couple of decades in the past few years. But what did orthopedic look like during your father's era? Because you were very involved, and how has it evolved now when you are now a practicing surgeon?
Yeah, I can say my father's generation practiced it with limited resources. And I remember in 2005 when my father was setting up, I think, the first orthopedic hospital here. It was at that time called Al Kausar. I think that was 20 years back. So I remember him inviting one of his supervisors back home, and one of his friends is called Dr. Muhammad Ismael from UK, and he invited them so that they can join him. So at that time, also I was around, but I didn't even start medicine at that time. So I was just around writing, helping them write some of the documents with them. Yeah, so they practiced it with limited resources. I remember there was no locking blades, there was no nails, nothing. But when I came back, I met with Indian manufacturers, and I think I was the first to bring locking blades here. With the help of Arfa, we were the first to get sign nails from sign company, and things were improving slowly with the support of other partners.
Mm, wow, that's quite a long way, isn't it, when you think about it? And
There
you know,
was no one doing also, sorry for to disturb you. There was also no one doing total knee replacement, total hip replacement, sports. So Mamo was the first to come here. I told him to come and visit us here. At that time, there was no arthroscope, just to do the clinic, and a lot of people know him just because of his initial one visit. I also brought some Indian doctors and did the first hip and knee replacements here. Yeah, so we changed it a lot.
yeah, that's amazing. And I love how your print is in all of it. You know, even when you were not even a medical doctor, you were still involved helping your father write notes and things like that. And then you saw all the challenges they had, and when you were a trained orthopedic surgeon and you went back, you did all you could to bring modern orthopedics into the country. I know you have colleagues as well who, were with you through this path, but few of you have made this change, and I am a witness to that. And even in Ethiopia, we had a very similar history. It wasn't long ago that we used to have non-locking nails, right? And people were treated with traction and things like that. And over very kind of what seemed like a very short period of time, this revolution of modern orthopedic practice came in, and a lot of things have changed in a very short time relative to what has been going on prior to that. So I love that. And you also mentioned that your father, there's a lot of pioneership I think you've been exposed to, because your father also started the first private orthopedic hospital in history in the country. So it's that is so amazing.
Yes,
So
and he was the first to separate orthopedics from the general surgery when he became a director in 1979. Yeah, because they were just surgery. So he started, I think last time you were with us to visit the male orthopedic ward and female orthopedic ward, and these things were created by him.
that's amazing. I love that. I'm a big fan of your father, by the way. So much respect. He's an
Like,
amazing
come on.
human being. And yeah, and you're very similar to him. And I see when I see you, especially after I've met your father, I was like, oh, okay, that's where it comes from.
Mm.
So you've studied in Ethiopia. You did your orthopedic training in Ethiopia, and then you did fellowship training in Turkey as well. So you've kind of seen some of what goes on in the African healthcare setup and orthopedic care, and some of, Turkey is part of Europe. So, and they're very quite advanced when it comes to orthopedic care. Um, so, what similarities have you observed in these healthcare systems that you've been exposed to, and what differences have you noticed?
Yeah, this, I think the biggest difference is the infrastructure. They have bigger systems. They have uh, better implants, I can say. But when it comes to the empathy and taking care of patients, I think we are similar. That's the one thing. One thing I noticed in Ethiopia was patients are grateful in many places that I work. So, for example, if you are taking care of an Ethiopian patient and you want to do the surgery again tomorrow, it will be very easy to accept compared to many other places that I worked with, which is a bit challenging. Uh, so I think the Turkey and other European countries are better in this infrastructure part and the systems. But when it comes to the empathy, I think we are safe.
Wow, that's beautiful. Um, because, it's when you have everything available to you, it's very easy to be compassionate, right? But it always amazes me, especially surgeons and doctors who work in a resource constrained setting, because when you walk in, you're not going to get what you want. Whatever you ask for is probably not going to be there, or it's going to take you
Yeah,
another 2 hours to find it, right?
definitely.
um, and I don't say it with pride, that's just the reality of our lives and our practices. But even with that, we still bring compassion and care and empathy towards our patients. Maybe even a little bit more compared to other countries, I would dare to say. Um, but do you think the cultural context influence patient care in each setting? Have you seen that?
Do you mean that in Turkey?
Yeah, like whether it's in Turkey or Ethiopia or Somaliland,
Yeah,
those are different cultures, like
yeah,
kind of very completely different cultures. We're neighboring countries, but we have very different cultures, right? So how does that cultural context differ in providing healthcare? What's your observation?
yeah. To me, where you work, for example, here in Somaliland, for example, like even though patients are not educated, they are always obsessed with the X-rays.
Hmm.
Yeah, naturally. So by next day, they will be asking you about this screw is a bit longer, this screw is a bit crooked, and all these things. And so it takes time to explain all of this compared to Ethiopia. Yeah,
What about Turkey? Was there any difference, the cultural,
in
the way the
Turkey,
patients?
most of the time they prevent issues. So um, every time we do, for example, total hip replacement, the C-arm is on. They want to make sure that every screw, everything is perfect, and they have to correct it before even the patient goes out from the OR. So that difference in the infrastructure really helps them do better care than here. I remember when we had visiting Indian doctors here, and we were doing malleolar fractures, and they were asking, "Where's the C-arm?" And like in Ethiopia and here, 99% of the time you're doing perfect job without CMs.
That's interesting. Yeah. It's always funny in a way and kind of a cute, may I say, to see these people who work in a setup with everything available, and then you bring them to setups like ours and they don't even know what to do. You can see them, they look like deer under
Yeah,
in a headlight, right? Like they're like,
yes,
what? And
yeah.
that's just your natural environment, and you're
And
just
have yeah, and have you witnessed the impatient they become when they are when they are challenged with that situation?
yeah,
Yeah, they
exactly.
start shouting. They become very upset and angry and just laugh around because this is your night, this is your routine every day.
Yeah, very much so.
Yeah,
I think we're just used to, our expectations are also managed accordingly because we know that 500 different things can go wrong when we're doing the surgery. So we're prepared from plan A to plan Z. So it's like, if this doesn't work, I'm going to do this. If this doesn't work. But for them, they come from this setup where, first of all, there are, specialty trained nurses um, and other OR staff. And we don't have that. we do the training while doing surgery at the same time, because our the other staff working with us are not trained specifically in the area that we're doing surgery in. So, we just juggle so much. I swear, we deserve Nobel prizes.
Yeah, definitely.
Yeah. Um, and also, I remember when visiting Somaliland, it was very interesting to me to see when patients come in like car accident and things like that. Um, so consent, especially when it comes to children and things like that, yeah, the parents or the guardian is supposed to give consent. But in Somaliland, the tribe has to approve, right? And no surgery can be done before the the family or tribe of whoever caused the accident and the person who was in the accident come together and get to an agreement. You don't do anything.
Yeah,
That was just so amazing to me.
yeah. Number one, the consent is done by the family. So if I get into accident, it's not me who will sign my consent. It's the family. Like they'll call Dr. Ismael to do the consent. So it's same for my wife. Like when she was going through C-section, I was the one who was doing the sign. So I have to leave. I remember one time I left from Columbus. I told Professor Brook, give me 1 week of leave because my wife was delivering. So I came and we did the surgery. Yeah, yes. When it comes to accidents, the two families have to come together, agree, do some notary work, and then only the surgery can be done. Yeah,
That is amazing. That is just, I don't think the rest of the world is not ready for what's happening in Africa. It's a different level of medicine that we practice. So
yeah,
it's amazing to me. But I love it. That's what makes it beautiful, you know.
yeah.
That's what gives you the stories to tell. That's what makes, your path, your journey through medicine worthwhile despite the challenges. So you know, a lot of times people think, as doctors and surgeons, we should provide service for free as much as possible, or work in a public or government setup. And to a point that it kind of sounds taboo to even do private practice, especially in Ethiopia. It might be different in Somaliland, but in Ethiopia, a lot of people don't like for their surgeon to be going to a private practice and doing private practice. Um, so, how do you compare the two, private practice and public practice? And what would you say to those who question the value of private practice or the ethics of it?
I think it's also the same here. And people think that going to a private practice is a taboo, and that private practice doctors are like crooks and things like that. And most of the time, you can see from social media in Ethiopia and here, everybody is like 99% of the time, people are writing negative comments. Yeah, but I do believe that private practice is gives freedom, especially the one who runs it, and it's free from politics that I see in the public hospitals that I work in. You have the freedom to choose the best implants. You have the freedom to even cancel patients and surgeries if the situation or the environment is not right. Sometimes, for example, here in Hargeissa group, we have four OTs, and they may do like a general surgery the night before. And when you come in the morning, you may not be happy to operate because of the environment. It will be a bit challenging to cancel that patient. But if it's a private practice, you have the authority to say we can't do it today. It's elective. Let's do it after 2 days, unless it's emergency. So as long as it's giving service and comfort in the private practice, I think it's not taboo. Yeah. But leaving, neglecting public hospitals is taboo in a way. Yeah.
Yeah, like you said, I love how you described it because private practice honestly is better, especially in Africa. It's better. Um, in some countries, well, in some countries, actually, there's really not much difference between the public and private, right? They're all on the same level. Um, well, for so many reasons that we cannot go into, but um, it's cleaner, it's more specialized, like you said, in public hospital because of resource constraints. You might have to share your theater table with other departments, and you can't be doing hip replacement on a table that just had laparotomy. Like that's insane. That's horrible for the patient. Um, so there are certain advantages, and I also think, you know, as a professional, this is our profession. This is the only thing we have to make money with. What else are we going to do? Right? So in public hospitals, you do the kind of the what seems almost like free work, like because we don't get paid that much. But you also have children, you have your family, you have parents that you have to take care of. Maybe they're sick, maybe you have siblings that need help. We also have lives, and we also need to make money, and this is the only skill we have to sell to make money, right? So I don't think it should be a taboo. I don't think anybody should be shamed for providing their skills, as long as it's safe and quality and as per the standard. Yeah. But like you said, it's very interesting. They do that. There's a lot of
Yeah.
negative.
Let me ask you one question. Like, if you are working in a public hospital, um, how able are you to provide free service to three patients? Can you? From
Mm-mm.
A to Z, it's difficult.
Yeah.
In private practice, I see the patient, I decide if the patient has no money, I can do the service for free. And if they are able to, I charge them. So yeah.
100%. Yeah, you have no decision making power. Your decision making power is very limited in public hospital, like you just said. But
Mm,
in private, you have more influence. So if you see someone who can't afford, we're still you we're all human beings. We're compassionate people. So you still provide the services despite whether they're able to pay or not. And I don't think people really understand. So yeah, thank you for pointing that out. um you mentioned about bureaucracy, which is really stagnant in, usually in the public setup, just because it's attached to the government bureaucracy. How do you avoid that? What do you do to avoid that in your private practice? Because you now lead the private practice that was owned by your father, and you've done so many expansions to that private practice. So how do you make sure the system is updated, new, and not bureaucratic?
yeah. Number one is, everything starts from the leadership. And as long as your team members, whether they are surgeons or nurses or accountants and all this, as long as they know that you're trustworthy and you're avoiding like politics, everybody will be interested to work with you, and they will also avoid to start any gossip and all that, because it's gossip and things like that that destroy organizations. Yeah. So I think it's the leadership that
Mhm.
prevents all this bureaucracy.
Yeah, 100%. I agree because there's a saying. I don't know if it's an English one. I know the Amharic version. It's like the fish starts to rot from the head, right? So if the head is whoever is in leadership, practices and does things in a way that could set example for everybody else to follow, then, like you said, it's much easier to make sure resource usage is efficient and effective, and you can maintain a certain level of quality and flow. Yeah, thank you for sharing that. So, you know, you're a practicing surgeon and you're a teacher, you're an academic because you're part of the orthopedic department and you have residency program that was recently started, which is, would commence congratulations to you and your team. And you also have private practice and you're the CEO of that private practice, which is a big one, because I've seen it and I've been there. So what that's a lot of things to do for one person. So what mindset or strategy help you navigate this different roles without losing your sense of self?
Yeah, I think surgery needs focus and leadership needs vision. Uh, and yes, it's difficult to handle all these different hats. Especially, it was very difficult in the initial years when I was starting the hospital because I started it from zero. Uh, you will feel burnout. You, especially when you have a family, it will be very difficult to uh, balance that. But every time I was working, I was remembering a conversation I had with Richard in Sodo. You remember Dr. Richard? Yeah, I was there with him for 3 months, and the last day he just called me and he gave me an example of an orthopedic surgeon in USA who lost his life because of focusing on orthopedics. And every time I was doing this, leading, doing a lot of work, and burnout, still I had that memory in my uh, mind. So I tried to delegate. I tried to empower others to be able to run the hospital so that even if I leave, it can work without me. I remember I made a new manager and I empowered a lot of sub managers. And then I went out for orthopedic subspecialty. I was away for at least 6 months and they didn't need me. That time I noticed that I built a system that can run without me. I think that's the goal, to have other people do the work without you.
Yeah, 100% agree. That's beautifully said. You're right. Like, if your work needs you and can't do without you, then you are failing as a leader. So that's the perfect example of how we leverage delegation. And there's a lot of it's when you have people that share your vision and you have instilled that vision very well in the other people, that's when you have such team members that can carry the work despite your presence or despite your absence. So that's beautifully explained. um, so what vision do you have for surgical education specifically? Because I'm an advocate for education because that's where you're going to have the biggest impact and the most sustainable impact. So, what vision do you have for surgical education in Somaliland and in Africa as a whole? And what innovations do you think are going to shift um, the surgical education environment?
Yeah, I think the first thing is we have to be like we have to move from dependency to self-reliance. Uh, it's shame for us to just bring foreign doctors from other countries at the same time bring their implants, and it means like they are doing it and they are using their implants. So uh, maybe in the coming 10 years, we have to become self-reliant. We don't have to only produce surgeons, but we have to produce people who can innovate, make products that we can use, and take our education to a level that we can even export doctors to other countries. I think that is the biggest vision that we must have in Africa. And I remember in 2019, I don't know, 2019 or 2020, around 5,000 people left Somaliland for to seek medical care abroad. You can imagine. So there is also a lot in Ethiopia going to India and Turkey and other places. So we have the ability, but it just needs a decision from our leaders and us and the people to unite and innovate so that we can be powerful and yeah, do things here, not outside.
Mm, yeah. So how do you think, what's the role of the surgeon? Um, because sometimes as a surgeon, it can be confusing to understand. Yes, you are the person who's doing the immediate teaching, right? But sometimes you don't have the authority uh, to do to allocate resources as if somebody who is in, let's say, Minister of Health in some sort of governmental position would have. So what would be the role of us, the surgeons, in making our system self-reliant?
I think most of the surgeons are busy in either the private practice or the public practice. So I think as surgeons we must be involved in politics, not being like ministers and things like that, but uh, having discussions and meetings and forums with the other uh, government leadership, yeah, so that we can discuss and maybe create vision together. And we must also participate in maybe technology meetings that are happening and other maybe business meetings. We must all be involved in those uh, areas so that we can give our influence. We don't have
Yeah,
to be in the hospitals because that's where we only teach, but we cannot innovate there.
that's very true. That's very true. Because it takes a lot to change the system, right? You need to go beyond those four walls of a theater or a ward and be comfortable enough and understand that you have value, like you said, whether it's in policy making, whether it's in uh, tech related innovation in medicine and patient care, just so many different branches to it. Because I think as doctors, it's very easy for us to just think, oh, being a doctor is just going to the hospital, treating patients, and if you have students, you teach your students, and that's it. But healthcare system is a combination of so many different inputs, and it involves a lot of stakeholders. So we need to be able to interact and contribute and make ourselves available in all of those areas that's going to help the system to change and shift and be better. Um, and I ask you about innovation because in Somaliland, I remember it's one of the places where people are very tech savvy. And it always surprises me. Like, the person, I don't know, like, might not be wearing something fancy, just whatever, right? They're just normal people. But when it comes to tech, they are 100% or 200% better than the average person, even living in, tech advanced countries. So I don't know, maybe you guys can leverage that because you already have a population that thinks in that direction. They're very innovative, they're very adaptable to new things. So, you think that would come in handy?
Yeah, I think because when it comes to technology, I think Somaliland is a bit ahead in many other countries. Yeah, so I think we can use that as a leverage.
Yeah, I think so too.
Yeah,
Um, you've worked, you've mentioned this, and you've worked with diverse donors and partners. What have you found to be the most effective way for maximizing impact of partners, whether they're local or international? And and then how do regional collaborations play into the success of um, improving health system?
yeah. I think when it comes to donors and partners, I think the most important thing is the alignment. Uh, as long as you're aligned with their vision, there will be a good partnership and there will be a success. Most of the time, especially in Africa, when partners are coming to donate, I know like a lot of people are thinking to get some benefit for their service. But when you are aligning with their vision, for example, if they want to take care of this number of patients and you are also committed to take care of that number of patients and you are aligned, that partnership will exist longer. So I think that's number one. And the second thing is like the transparency. So as long as you're connected with them and transparent and trustworthy, the partnership grows. Yeah.
Alignment and transparency, those are great points. Yeah, what do you think of, because most of the time, um, I guess we've been, especially in orthopedics, we've been lucky enough to work with partners that are very specific to our niche, to specifically orthopedics. But and I'm just asking you this general question because it interests me. But like big big donors, we don't need to mention names, come with a program that they think is good, but it's not necessarily what is needed. It might be needed, but it's not a priority for us, right? So, what do you think should be done? Should Is it okay to just do what has been done so for so long, just accept, whatever they're offering and just do whatever? Or should we have more say, and should we leverage whether it's data or other resources to make sure they are aligned to our priority?
Yeah, I think that comes back to our connection and our relationship with the government and the other leadership roles. And as long as we are involved in there, we may uh, persuade them or we may share with them the needs that are priority now. Because sometimes you can see a project, as you mentioned, uh, that's being conducted in the hospital, when in fact it will have been better to have a better operation theater. They'll be investing like 100,000 USD with something else, but you may just need like 30,000 to have a proper OR instead of having like tiles and floors and things like that. Why do we need to have tiles when we need a better OR? So most of the time, it's our lack of our influence in the leadership role, in the government influence.
Yeah, so it's like you said, we just have to be involved as surgeons. we
Yeah,
we need to be involved in those decision
yeah,
making process. I love that. So what transformations do you foresee, with the emergence of you're gonna have female orthopedic surgeons soon, right? Because you
That's fine.
have, yeah, so they're coming, which I'm very excited about. I've met, I think, two of them at least for sure. I've met some general practitioners at your department, but I know the two in Juma, and they're just phenomenal. They're just amazing young ladies. So, how do you think this is going to shift the cultural landscape of the field? How do you think the patients are going to receive it? What sort of environment are you guys preparing to really support diversification and inclusion of women in the orthopedic field?
Yeah, I think it's going to be a big challenge for them because they will be coming to a place where uh, men are seen as the surgeons. So they will definitely face challenge, but all it needs is us not only to uh, allow, but to support the female orthopedic surgeons. It's not like initially people thought it's like if you go to orthopedics, you just need muscles. But I remember you when in solo, you were the fastest surgeon when it comes to nail. You scored like 8 minutes, as Dwayne Anderson says, and I was planning to beat you, but I was second to you. I got 10 minutes. So it's not power, it's brains. Yeah. So I think we need to support our female orthopedic surgeons, especially for us. It's different. They will be the first. And I was just discussing with one of them, and I hope they will face the challenge. Yeah, and will support them as well.
Yeah, that's wonderful. You're right. I also have that concern, just because cultural contexts always matter, right? Even for me, when I was just starting out as an orthopedic surgeon, I was at Gondar University, and I have a ward full of patients, and I walk in, and the patients are like, they think I'm a nurse. So they address me as a nurse. And when we're doing rounds, we have all these people, right? Residents, nurses, physiotherapists, like everybody's going to be around the bed. And I would be talking to them, but they're like, could you please tell the doctor to do this for me? And when I was early on, when I was a medical doctor and as an intern, it used to be offensive. But then I kind of realized, you know what? They don't know any better. They haven't seen that many female surgeons. They don't know that women can get to that level. They think because all the people they've seen at that level are just male, they think, oh, okay, it must be the man, right? And when they tell me that, I used to say, yeah, I'll tell him. And everybody around me used to laugh. And after we leave to round on the next bed, they used to tell him, she is the one who's going to do the surgery, she is the one who's going to make the decision. So it's always funny, but I think, yeah, they're going to have an interesting time. um yeah, and I just hope that people would give them that grace and forward compassion towards them, so that they can help them grow and support also other women to join the field. It's going to be very interesting. And what do you think you guys as males can do? You kind of have touched on it, like you can support them, but in what ways do you think we can support um, not just female surgeons? Because sometimes it has been my experience, and I'm sure it is similar to you, uh, that doctors who've been practicing in rural areas, who have never been exposed to orthopedic procedures, like they see orthopedic patients, but the resources are not available, so they haven't even done any orthopedic procedures, and now they want to come and do their residency and things like that. So how do we make people with less exposure to orthopedics, how do we welcome them, and how do we make it a conducive environment, and also how do we encourage women to join orthopedics?
Yeah, I think the most important is giving the space. So most of the time, a practicing surgeon will have more patients. A lot of people will know him, and even patients will prefer. So, for example, if I'm operating on Monday, um, five of the patients will say like, we need Abdirashid. But if I tell them directly that I cannot operate all the five and I can only do two, I have my other female colleagues or other male colleagues around, then I think that is the selling part. You should be able to give it to other people. Yeah. So I think that is the only way we can support with our female colleagues. Like give them the space and let them operate, even if you came ahead of them. Yeah.
Yeah, 100%. Like you said, it's empowerment. You just have to empower them and be their advocate, be their voice when there is doubt as to their competency, because it has nothing to do with competence. Um, it's just the way you're born. Like you said, the brain is doing the other stuff. It has nothing to do with anything else. So I love that you described that. Um, And lastly, what do you, as a pioneer, you and your friend Dr. Ahmed started basically the modernized orthopedic department, which already existed prior to that, and you are now taking over your father's legacy and expanding it in an amazing way. By the way, more power to you on that. A lot of us admire you for that. What do you see for the future for yourself? What kind of impact do you want to make? What do you want to be remembered for?
Look, is I still didn't reach my vision. Uh, in 2017, I think, when I was in residency, I was writing my biggest goal, which is to have a dedicated orthopedic hospital, which is currently existing. Uh, but now my 10-year vision is to have a hospital where everything can be done here. That's my biggest dream, which still I didn't reach it yet, but it's just a dream, and I hope I'll reach there. That's my biggest vision now, and I don't want to be like just the surgeon there. Have other doctors, friends, and colleagues working in there, so that I can also have more time for my kids and my families. Yeah.
Yeah, I mean, I love that you mentioned that 2017 you were still in training, but you were writing down your vision as to
Yeah.
what you want in the next couple of years, what you want to achieve. So I think that's very important lesson that a lot of people can learn. Because sometimes people think they don't want to jinx it, right? Like when they're like, oh, if I think about what's going to happen when I get there, then something like, what if I don't get there? No, you are going to get there as long as you put in the work, right? You are going to get there. But when you get there, then if you don't have a plan, if you don't have a vision, then it will all be for nothing. um, and then it's going to be easy for you to be taken away by other people's plans if you don't have anything for yourself, right? And you'll just be working to make other people's vision come true, which is fine. I mean, I guess not everybody can be a visionary, right? Um, but it's very, very important to have that blueprint for life. And I know you're going to make it happen because I've seen you work, I've seen you innovate, and if you can't make it happen, and then I don't know who would. So, um, yeah, we are very happy to see the achievements that you have conquered throughout the years. Not long ago, you were a trainee, so this is really amazing. And we hope that orthopedic in Somaliland would grow even more and produce more surgeons like you. So thank you so much, Abdurrashid, for coming on the Everyday Leader and sharing your experience. It's been great. It's been authentic, And we hope to have you back here and talk about, new things in the future.
Thank you so much, Ananya. And I can't forget the everyday leader. Like you were my senior, and I saw you go high. So you're really one of the inspiring people I have met during my training. So thank you so much, Ananya. Yeah.
Appreciate that. Thank you.